A lot of the clinics around here have closed, so yeah, I think the community is really underserved.
You're dealing in an area that's which may be classified as the rough area. The patients may have the difficulty of going outside. They may not want to leave because it's the wrong time of day.
5% of the Medicare population generates about 50% of all Medicare costs in this country.
There's no car, to go to the doctor or nothing like that.
They would have to take off just to a day's work or something to get me to a doctor.
Well, I think the biggest challenge is the amount of uninsured. Depending on what study or report you read, there's anywhere between 40 and 48 million uninsured.
The next time I went to the doctor, he wanted $200 for the medicine, I said, I don't have $200 to pay for the medicine. It's too much money for me.
They didn't have too much patience with me, some of the nurses, where I was at in this care place. But I don't know. I don't even like to think about that part.
I get to walk into the door and say, hey, this is the doctor of the neighborhood, and I get to help someone who may not have received help if I didn't come into their home.
If we can provide more efficient, quality care at a lower cost, that is win-win-win.
It saves a lot of time. It relieves a lot of congestion in the ER. And I really do believe we serve the patients better.
After I met Dr. Martinez, he's a gift from God. Whenever I look for him, and he's my buddy. He's my doctor, and he's my friend. That's what I think about it.
Our model of care negates culture and actually goes straight to people who really need it. Costly hospitalizations for the fragile elderly and underserved minorities is oftentimes a difficulty too hard to bear.
They got me in there, and it took them, about 8-9 hours in the ER before they got me upstairs. And they started me off on all the medicines, IVs and all that. And I was in that hospital about a week. They sent me home, and then a week later I was back in the hospital. And it took them 19 hours in the ER to get me going.
How many times did you usually go to the hospital?
Before I used to go about once a month.
Once a month?
Or sometimes every 2 weeks. So now I stay about 3 or 4 days, sometimes a week, and then I come home. But a month later, I go back again.
And since we've been coming, how many times have you been to the hospital?
I haven't been to the hospital.
The physical difficulties of getting to a doctor's office results in patients putting off care until their illness becomes debilitating. This not only impacts the patient, but also the quality of life for their families.
I think he would be ready. He'd be sitting down and say, I just can't go no further. So, with the doctors coming by, I didn't have to go through with all of that. It was just a blessing.
Consider that contact with people in waiting rooms who are carrying contagious illnesses may mean a setback for the fragile elderly. Difficult and uncomfortable transportation, even lengthy wait times, are not worth the 5-minute visit with a doctor that is often too short to diagnose multiple ailments.
When you go to the doctor's office, when you get there, he comes in and you sit around and you wait for him. And then he comes in there and he's got his pad and he's looking at the pad, and he's asking you questions. And then you say, oh, okay. And then I'll see you in so many days, so many days.
They didn't treat you like a person. It was just, you're a number coming in, let's see what's wrong with you, and then send you on your way. Here goes your prescription, take these, and come see us in 2 weeks.
The patient that, when a patient calls after hours or at times where I can't see them immediately, they get seen by a doctor. We work together, so it's all part of the same healthcare system that way. They've been the highest quality doctors when I've been, the doctors I've been in touch with. I have all the confidence in them, feeling that when they're seeing my patient, it's just like I'm seeing their patient.
I wasn't sick, but he was. It changed my life. It gave me strength. I didn't have to do as much as I would have done if they hadn't been coming to the house.
Basically, we've sent the physician like myself into the home to say, hey, there's someone here for you 24 hours a day, 7 days a week. It's no longer a pager, there's no longer an answering service, there's a cell phone, you call me directly. And patients seem to at first to be leery of that, but now it's a matter of, wow, just pick up the phone and Dr. Henry will answer.
He told, just like he told me, I could call him any time of day or night. That makes me feel good and makes me feel comfortable.
I did spend more time in the hospital. Now I'm here more with my kids, so makes me feel a lot better.
I love home. I've been in the hospital enough.
You get the personal attention, you see, and he sits down and he talks with you and he asks you how you feel and, you know, if you have any problems and things like that. He spends time with you. So in that way, it really helps.
He comes in, he talks with me, asks me questions and things while he's examining me, checking my heart, you know, and everything. And he'll sit here and talk with me for a while. He doesn't rush. He takes his time, and he listens to you. It doesn't go in one ear and come out the other.
I'm not afraid to ask him any questions. I figure he's here. I figure he's here to help me, you know, and how many people really come out of their way to help, come into the home and help.
Somebody out there cares. I said, if it get too bad, I'll call Dr. Martinez. It really makes you feel better. I think it even helps the sickness. It helps the home and everything.
Sometimes he'll call me and tell me he's near. And I tell him, oh, shoot. I think, can't you come a little later or tomorrow? He'll say, well, I'll see. Next thing I know, he's knocking on the door. Regardless of how I'm dressed, what I have on, or anything, he just looks at me as a person.
Other people need this. You should put it forth. They need it very bad. A lot of people need this very badly, just like he did. I would tell him, go forth with it. Sure, it helps. It's the help to the people.
I know if it worked for me, it should help the next person.
I would recommend it highly. Oh yes, this is the thing, and I hope it spreads everywhere. I hope this will go back to the time like it was once before, because this is really helpful to us, especially to the older people.
Let it go far to help the patients. Keep them out of the hospital, even keep them out of the grave. It's really a help. Yes, it's really a help. I never thought I'd live to see doctors coming back to the house. But it's really great. It's really good.